got out of the way.
Sorry.
My bad. No, you're good.
And you just need your blue light on.
Is it already?
So hit the blue and push in or out. Perfect. And then, what do we do next here? Raise the table. You can stop at a height that's comfortable for you. And then 40, yep, because everything table is 40. Only don't fall asleep. So since we're doing our L spine, we're going to find the patient's crest, iliac crest. And the light's not turning on, so I'm just.
Is there a? Don't we need the thing here? For the collimation to work?
I turned the key, so it's working now. Alright, so find her iliac crest.
Pardon me.
Over here. Perfect. Yep, so you're going to find her crest, the horizontal beam at that level, and then of course, the vertical beam, you want it at her midline. And then you want to make sure the patient is straight. Scoot a little to your right,
I can just flip it.
Popped out.
Oh.
That's fine. You actually moved the right spot.
Okay, that looks good. So, for the L spine, you want L1 all the way to L5, possibly a little bit below it. So your length is going to be 17 inches, which is just like what?
KB.
The T-spine. And the width, it says here 8 inches, but 7 is also fine. At LBJ, they do prefer their L spines kind of wide open, like a KUB, so you may notice the text open it all the way up. But if you're at Ventab or any other hospital, you keep it narrow just for the L spine.
So if we
And-
collimate and they open it up, do we just leave it like that?
Mm-hmm.
Marker goes here, right? Like,
Yes. Yes, I would mark on the upper portion. Point your belly button for me. Okay, so we're pretty good. So that was our APL spine, pretty simple, right? Next, we have our lateral L spine. So go ahead and turn onto your left side. Centering is going to stay the same at the level of the crest.
okay. I'm gonna float this table forward so I can grab the sheet. Like, move. Do you wanna back up a bit? Pardon me.
So her, see how her left shoulder is tucked in? You want to tell her to bring it out. So don't just push her, actually tell her, can you bring this left shoulder out towards me?
So,
Yes, just like that. And then we can adjust her.
Oh, okay.
Mhm. And
Sorry about that,
then
Melanie.
scoot just your hips forward, just your hips. Perfect. So now she looks pretty straight to me. Centering is going to be still at the crest, so go ahead and center.
We don't pull the sheet a little bit forward to like bring her centered with the.
You can always flow the table to center her.
too far forward?
I would center where the waist naturally kind of dips.
So, should I be here instead?
Yeah, so once we are centered at the level of the crest, do you think we're going to be right at MCP?
No, I think we're gonna be.
We're gonna be a little bit posterior. I would say about 1.5 to 2 inches. And you do want to see a little bit of light behind her back.
So
Not too much. Yeah, just about that much.
Okay.
Let's keep the length at 17.
So 10 by 17?
Mm-hmm.
And we marked the side that's touching, so I put a left side here.
Correct. Any questions on that? So, can you walk me through what we did, Samantha, for the lateral L spine?
Yeah, so we, put her on her side. We centered at the crest.
Mm-hmm.
And then for the lineup for MSP, we made it like about 1.5 inches.
Mm-hmm. Posterior.
Yeah, posterior. And 10 by 17 collimation.
Yep.
And a little bit light on the table.
Correct. And then, of course, you want to make sure your bucky's always lined up with your central right.
Was it not?
It was just slightly off.
It's fine.
So that was our lateral L spine. The breathing for these is suspending at the end of expiration. So take a deep breath in, blow it all the way out, hold it out, and then expose. You can breathe.
No, it's this suspended expiration.
Mm-hmm.
Okay.
Yeah, both for the AP and lateral L spine. So from here, we're going to go to the spot. So what we're going to do is,
The spot is a cockpit.
no, that is where they're looking at the space between our L5 and our S1.
So,
So,
or is that too much? Why?
so according to the book, you're going to go 1.5 inch below her crest.
No, I was too far down.
Okay, and then from that point, we're gonna go 2 inches back. So push the table forward.
I can't.
Oh, you can't.
That's why.
Yeah, use this sheet.
Yes, ma'am.
So you're looking at a joint space for the spot.
Yes. You wanna look at that area right in
I'm gonna
between.
pull you a little bit forward so we can get a little bit of space here.
All right, perfect. So. From her crest, what did I say? 1.5 inch below,
2 inches.
2 inches posterior. And then collimation for that is very tiny, 6 by 8.
6 by
Text may have it even smaller.
What was I at before? Like 10 something?
Yeah, 10 by something.
So what is the spot looking at exactly?
The space between L5 and S1.
Oh, okay.
When I was a tech, I would eyeball it and focus on where that natural curvature happens, you know, to where their back ends and their butt starts to kind of curve. I would kind of put it in that area.
So, is that kind of where like this little dip is?
Yes. Like right at the end of the small of your back. And then you feel that curvature starting to happen. So I used to kind of like do this on my patients, and as soon as that stopped, that's where I would put my centering. Does that make sense?
Mm-hmm.
So that's your spot. For that, breathing is just tell them to stop breathing. Nothing really specific. Also, another trick is after you do your lateral L spine, take a look at your image and see where is your L5 on that x-ray. And then you can judge, do I need to stay right where I'm at and just collimate, or do I need to center a little bit down? You know what I mean?
Yeah.
All right. So now we're gonna move on to our oblique L spine, so you can turn onto your back for me, Emily. And what do the obliques take a look at? I think Mr. Donahue went over that yesterday.
Obliques go over, they're
What
the
joints?
The zygapophysis?
Yep. Hold this for a second. So oblique L spines, there's only RPO and LPO. So go ahead and turn 45 degrees away from us. Perfect. We're gonna put a wedge and then you're gonna come back. So this takes a look at the side that's closest to the IR. So what position is this? LPO. So what's our side of interest?
Right
Or
side.
Left. It's going to be the side closest to IR. So centering for this,
Hold on.
so we're gonna center on the upside, not on the downside. It's crazy. The side of interest is the side that's touching the IR,
Right.
but
Oh, we're centering.
centering on the upside.
Right.
So what we're going to do is find her as is. Could you point your as is for us, please? Not the crust, the as is.
Cool.
So in the pocketbook, it has a weird wording. It says 2 inches medial to as is, and then 1.5 inch above iliac crest, which doesn't make any sense to me.
So that would be
So
here.
this way then up?
Yeah, that doesn't make sense to me, so the way that I'm gonna word it is from the crest, go 1.5 inch up, and then from there, go 2 inches medial.
So,
Wait, crest?
got
No,
it?
as is.
In the book, it says as is,
Did I
but to
get-
make it simple, find the crest,
Okay.
from there, go 1.5 inch up. So our crest is here.
I don't know what the hell is this.
And then from that point, go 2 inches medial. Okay, and then your arms are going to be by your head. Yeah, just like that. So although we're centering on the upside, our side of interest will be the left side.
So mark the left side.
Yes. And marker placement for these. Yes, you would mark up here. I would have to confirm whether you mark the left side. I would think so, since that's your side of interest.
I would assume because that's the side that's down.
Mhm.
Probably a little bit more.
Collimation's going to be 9 by 14.
Oh, by 14.
Mm-hmm.
Okay. Why so wide?
I guess they don't want to risk cutting off the zygapophyseal joints. And because she's in an oblique, the spine is put in a weird position where if you collimate it too tight, we may clip something.
Okay.
You know what I mean?
So that accounts for the size of the spine and marker placement?
Correct.
Okay.
Yeah, so for these, I would mark in the outer corner here, and you would mark the side down.
So why now that it's this wide, why do this one instead of this one? Because there's no spine down here. That's probably.
There is no spine down there, yeah. I would be okay with marking down here or in this corner,
Okay.
but stay away from the inside.
I'm only asking for like test out.
Mm-hmm. Yeah, you can mark the right bottom or the right top. And the legs, they can either be straight like this, or if the patient is more comfortable, they can keep it bent
Okay.
with like a pillow or something between the legs. So that was your oblique L spine.
So you'll specify LPO, RPO?
Yes. So just remember that the side that's closest to the IR is the side of interest, but we're still going to center on the upside. Alright, let's see here. I'll take this wedge out, so be careful. So that was all your L spines on the table, the AP, the lateral, the spot, and the obliques. There is 2 other L spines, but we'll do those on the wall bucky. Alright, now we're gonna